Hey everyone, this is Kelly with Two Broads Talking Politics, and I'm here with my co-host Sophie. Hey Sophie.
Hey Kelly.
And today we're going to be talking about public health, which is a topic we've wanted to talk about for a while, and we're finally getting to it. We've got some really great segments coming up later. We talk to Reid Wilson, who is the correspondent for The Hill, who just published a book called Epidemic, Ebola, and the Global Scramble to Prevent the Next Killer Outbreak. And we also talk with two congressional candidates who are doctors. One is Dr. Hiral Tipirneni from Arizona's 8th District, and the other one is Dr. Eady Mann from the Texas 31st District. But first, Sophie and I are going to talk a little bit about public health. Sophie, what's public health?
The CDC defines public health as the science of protecting and improving the health of people in their communities, which is pretty vague, I think, but I generally treat public health as considering the health of an entire group of people as opposed to an individual person, and it sort of has two aspects to it. Part of public health is promoting things that keep people healthy and sort of doing research into those things and trying to encourage people to do those things or use those things, and then part of it is also doing research on things that hurt people or make people sick and trying to prevent those things from happening to people, prevent accidents or illnesses from affecting people. Public health in the United States is pretty good compared to a lot of developing nations. Compared to other developed nations, however, we're not great. Our life expectancy in the U.S. last year was 78.8 years, which puts us at number 31 in the world. So that means 30 other countries have longer life expectancies than we do. Those countries include countries like Japan and Italy, South Korea, Canada, the UK, Greece, and Slovenia.
I suspect that the life expectancy in the U.S. varies quite a bit by demographic groups.
It does. It varies a lot depending on economics and depending on race. For example, Black women are 22% more likely to die from heart disease than white women. Heart disease is the number one killer of Americans, the number one cause of death. They're 71% more likely than white women to die from cervical cancer, and most shockingly, they're 243% more likely to die from pregnancy or childbirth-related complications than white women. That 78.8 years it's just a median, and so, I know a lot of people who live into their 80s and 90s, but there are a lot of people who don't live that long in the United States, so it varies very widely, depending on how much money you have, what economic class you belong to, and your race.
What kinds of money are we spending on health in the U.S.?
We're spending a crap ton of money on healthcare, which is interesting given that our life expectancy isn't so great. We spend more per capita than any other country in the world. So in 2015, which is the last year that we have complete data for, that the CDC has released complete data for, the United States spent, like everybody in the country, had $3.2 trillion spent on healthcare, and that comes out to about $10,000 a person, which is a lot and is way more than any other country, developed or developing. And interestingly, 32% of that, 32.3% of that was spent on hospital care. I feel like we talk a lot about nursing care and sort of continuing care, but that only accounted for 4.9% of our total expenditures. So the most expensive thing was hospital care. The sort of care that I think you think of typically is going to a clinic setting and seeing a doctor. Physician and clinical services only accounted for 19.8%, and prescription drugs accounted for 10.1%. And I think it's important to remember that also in that year, the percentage of adults between 18 and 64 who were uninsured was 12.4. So that's gone down since the implementation of the ACA, but there still are 12% of adults who are not obviously eligible for either CHIP or Medicare are not insured at all. So all of that money that they're having to pay for hospital care is going directly on them.
We are probably not the experts who can answer this question, but I think it's a question worth asking why we're spending more and doing worse. What are the inefficiencies in the American healthcare system? Or there could be other causes. Of course, maybe there is something about America or climate or, there could be other causes, but there must be some reasons that we are spending more money per person but not living as long.
I actually work for a healthcare IT company, so I spend a lot of time thinking about this. And I'm obviously not an expert in healthcare. I'm not a doctor, and I am not a healthcare policy expert. But in my experience, part of the reason is the way that we fund healthcare. In the United States, healthcare is primarily paid for through insurance companies, private insurance companies. And in the rest of the developed world, healthcare is primarily paid for by the government, and so the government negotiates contracts and payments directly. And so there is a bigger cost savings and less of a chance of sort of inflated costs. I also think that in the United States, there's a certain expectation of facilities in healthcare. In the United States, when you go to a hospital, there are a lot of hospitals where the facilities are sort of like being in a hotel. When I gave birth to my son, I was in a very nice hospital. There was a hydraulic mirror that dropped down from the ceiling if you wanted to watch the birth yourself from the mirror. There was a tub with fancy jets. There was a marble shower. I mean, it was very, very nice. In a lot of other countries, the focus is less on amenities, and the expectation is not that you will, have fancy food and have, like super comfortable facilities. The expectation is that you will get care and then leave. And so the hospitals that I've seen in Europe are much simpler and plainer and don't have the same kind of amenities, but they focus more on the actual medical care and getting you out of the hospital and back into your home. Also, in a lot of developed countries, care is done more in the home. I know in the Netherlands, for example, women who have babies, a lot of postpartum care that we get in the hospital the first few days out is done directly in the home. You have the baby, and then if there are no complications, you go straight home, and then nurses come to your home and do home care directly in your home, so you don't have to be hospitalized during that time. So I think it's sort of a different mindset and model of care in other countries.
Yeah, that makes sense. I don't think I've told the story on this podcast, but the best single food I've ever eaten in my entire life was the chocolate chip cookie I ate after Teddy was born.
Yes. After Ren was born, I had been in labor for 2 days, and I hadn't been able to eat anything. And they asked me, and they were like, we will make you anything you want. And all I wanted was a cup of coffee and a breakfast sandwich, like a bagel with egg and like sausage and stuff. And they were like, really? That's all you want? And I was like, that's all I've been craving. And it was the best food I had ever eaten.
Yeah, but, as good as that food was, I would trade better healthcare for everybody.
Me too. And also I feel like it was just that good because I hadn't eaten and I had just had a baby and I was sort of high on endorphins. So I feel like they could have just given me, a carrot and I would have been thrilled about it.
All right. So what about governmental budgets? What is the U.S. spending as a government on healthcare and on health?
So it's hard to know right now because some of the government is spending money on things like Medicare and Medicaid. Medicare is mostly what people are covered under if they don't have private insurance, but the government also through the ACA is providing the subsidies to purchase private insurance. So it's sort of tricky to know, but I do know that I believe only 20% of the population is on Medicaid. So it's not that huge, but the costs have been ballooning much more quickly than we thought they were going to. Yeah, it's something like federal government spending is about 18% of GDP right now, which is pretty big when you consider that we also spend a crap ton on the military. That's a pretty big slice of what we're spending. And it doesn't necessarily have to be that way. Our government spends a lot on healthcare and doesn't get a lot in return because we don't really invest very well in preventative care and in public health, at least not to the extent that other countries do. But it's still a really important issue for people. So in 2017, 16% of Americans said healthcare was the most important problem facing the United States, and that's actually up. It's really interesting if you look at the percent of Americans that say healthcare is the most important issue in the United States over time, because it peaked in 2010 and 2014, which were midterms, obviously, and both of those midterms were sort of seen as referendums of the ACA. And so I don't know, I just thought it was really interesting that people care a lot about healthcare sort of every 4 years and get really, really involved in it. And then sometimes it sort of goes on the back burner, even in presidential years. One thing I thought was really interesting was that the Kaiser Family Foundation did some polling on how people think of influence in Washington and who people think has too much influence in Washington. And the number one response was large businesses have too much influence in Washington. 76% of people cited large businesses, but 72% said that pharmaceutical companies have too much influence in Washington, and 66% said health insurance companies have too much influence in Washington. Contrast that to only 52% said the NRA had too much influence in Washington, which I thought was really interesting. I think there's a lot of sort of resentment of the private healthcare industry. And I think that tracks with polling that suggests that national healthcare, a public option or Medicare for all, has become more popular this year, and the popularity of that option has been rising.
I think it also speaks a little bit to the importance of rhetoric and framing the debate. We have the term big pharma, and people throw that around a lot, and it without necessarily a lot of looking at the actual data and how much influence does the pharmaceutical industry have. I think it does have a lot of influence, but the rhetoric is not always tied specifically to the actual amount of influence. So maybe we should be talking about like the big gun industry, or I don't know, some kind of term. But if you want to equate the different areas, if there was some way to sort of rank, maybe there is some way to rank the influence in DC of different lobbying groups compared to their, sort of slice of the American population or something. And how does that compare to the way we talk about those groups and framing that debate?
And when you drill down into the things that people say that they want the government to do, I was interested to see that 80% of the public think that prescription drug costs are unreasonable, and about half, 52%, say that President Trump and Congress should make bringing down prescription drug costs a top priority. So that's more than who think that the infrastructure bill should be a top priority. That's 45%, more than the number of people that think that ending the opioid epidemic should be the top priority. And way more than people who think that repealing the ACA, the Affordable Care Act, should be a top priority. Only 28% of people said that they wanted to repeal the ACA. It's interesting to look at what people think our government should be working on, because I'm not sure that I would have identified or pinpointed prescription drug costs as the number one top priority in healthcare.
Yeah, I don't think I would have either. And I think that is especially interesting because it is exactly the reverse of what the Tea Party would be telling us, that the government should be sort of taking a hands-off approach, and we have too much regulation and we should let the free market decide things. And if the number one thing that people are worried about within healthcare is prescription drug costs, and saying that the government should be doing something about that, then that's, much more like socialized medicine than Tea Party.
And I thought it was also interesting that so few people, when asked, had any confidence that President Trump could sort of help fix these problems. Only 39% of the public said that they thought that the president and his administration would actually do anything to lower drug costs, and only 28% said that they thought the administration was likely to improve the situation with the opioid epidemic. So there's also not a lot of faith that, although people want a lot of change in terms of healthcare and the government's attitude towards healthcare, there's not a lot of faith that this president will do anything about that, which I think tracks with reality. I thought it was really interesting what the top 10 causes of death in the United States are. I didn't necessarily expect all of these. Everybody knows heart disease is the number one killer in the United States, and cancer is number 2. Chronic lower respiratory diseases like COPD are number 3, but accidents are number 4. And accidents have actually gone up as a cause of death. Stroke has gone down. That's number 5. Alzheimer's is number 6. Diabetes is number 7. But influenza and pneumonia is number 8, the number 8 cause of death. Last year, 57,000 people died of influenza and influenza-related complications like pneumonia. And this is preventable. I know we've talked about before about how the influenza vaccine is not perfect and how it's not always super efficacious, but only 59% of kids between 6 months and 17 years in 2016 to 2017 had the vaccine, and only 43% of adults. And we could do better than that. So people, go out and get your flu shot because it's killing people. It's the number 8 top cause of death in the United States. And then number 9 is kidney problems, nephritis, nephrosis, nephrotic syndrome. But number 10 is suicide. 44,000 people committed suicide last year. So I think it's important to remember that mental health issues are physical health issues, and they kill people. So when we talk about, needing to improve mental health services in the United States, it is also a public health crisis just as much as opioid, which are related to mental health issues. But
yeah, and of course, death on a whole is not preventable, but our life expectancy numbers